Hello and welcome. Today, I will guide you through a realistic clinical scenario to demonstrate the complete wound dressing procedure. We will follow a nurse named Aline and her patient, Mr. Mugabo, who has a surgical wound on his abdomen. Nurse Aline prepares herself before approaching the patient. She wears a clean uniform, ties her hair back, removes jewelry, and washes her hands thoroughly. Aline approaches Mr. Mugabo, introduces herself, and explains the procedure. She checks his ID bracelet and confirms his name. Aline assesses his pain level. He reports mild discomfort. She administers prescribed analgesic and waits a few minutes. Aline helps Mr. Mugabo lie comfortably on his back, exposes only the wound area, and places an impermeable sheet under him to protect the bed. Aline prepares a clean, disinfected trolley with all necessary sterile and non-sterile items, placing sterile items on the upper shelf and non-sterile items on the lower shelf. Aline disinfects her hands again. She carefully opens the sterile dressing kit, exposing the inner sterile field without touching it, and arranges materials using sterile forceps. Aline wears gloves and gently removes the old dressing with forceps, placing it in the kidney basin. She observes the dressing for color, odor, and type of discharge, then removes her gloves and disinfects her hands again. Aline prepares sterile cleansing solution. She picks a sterile gauze with forceps and begins cleaning the wound from top to bottom and center outward, using a new piece of gauze for each stroke. She cleans the surrounding skin as well and dries the wound with sterile gauze. Aline applies ointment as prescribed, covers the wound with sterile compresses, and secures it using adhesive plaster. Aline helps Mr. Mugabo into a comfortable position again and arranges his belongings within reach. She informs him about what to watch for regarding his wound. Mr. Mugabo thanks her. Aline documents the wound condition, care provided, patient response, and the date and time of the dressing change. She washes her hands again, cleans and disinfects all equipment, sends instruments to the sterilization room, and disposes of waste properly. This concludes the wound dressing demonstration. Proper technique, communication, infection prevention, and patient comfort are essential to safe and effective wound care. Thank you for watching.